Well, thank you so much, and good afternoon, everyone. Thank you all for being with us today. I also want to continue to thank Dr. Toomey and her team at the Georgia Public Health Commissioner's Office and all the hard-working public health folks all across the state. And I want to thank Dr. Lewin and the whole team at Emory for hosting us today, and really appreciate all the hard work that they are doing. Dr. Lewin was just letting me know how quickly they're deploying the vaccine, which is very exciting news, and we're hearing that all over the state. I'm going to have just very brief remarks today so Dr. Toomey can provide an update on where we are on the vaccine rollout, and our experts can talk more about the Moderna vaccine the state is set to receive this week. Let me just again reiterate my gratitude to the Trump administration, Operation Warp Speed, and really a lot of healthcare experts, public and private, that have partnered to roll up their sleeves on the vaccine development, deployment, all the testing and everything else to get this approved so quickly yet so safely. As I said the other day, we are seeing a miracle of modern science happen right before our eyes, and it is well needed, I will tell you. We're certainly excited to be receiving 174,000 doses of the Moderna vaccine this week. Dr. Toomey can speak to more specifics, but I can tell you this. This vaccine will be easier to deploy and store, and it will be going to hundreds of public health sites, hospitals, pharmacies, and clinics all across the state to inoculate those healthcare workers under the Phase 1A program. As I said last week, these vaccines are safe, they're very effective, and we are working nonstop to get them out to our fellow Georgians following the CDC guidance. We are also eager for our long-term care facility residents and staff to start receiving the vaccine. We expect that will begin next Monday, December the 28th. And before I turn it over to Dr. Toomey and Dr. Raphael, I want to give a quick update on where we are in the fight against COVID headed into the holidays. As you all know, we've continued to see our numbers increase over the last few weeks in every metric as we have seen. And we continue to ask Georgians to do their part to help us stop the spread. Wear your masks, practice social distancing, follow the public health guidance that we have out there that's outlined in our executive orders, and continue to use good hand hygiene. This guidance has been in place for months now, and it has proven to be effective in slowing the spread of the virus, and we especially know that coming into the holiday weekends. We continue to be in regular contact with our hospitals, CEOs like Dr. Lewin here in the metro area as well as throughout the state, to hear and see what they are seeing on the ground and adjust course if needed. I'm happy to report that on December 30th, I'm happy to report that by December the 30th, we will have an 80-day supply of all PPE on hand, ensuring that we have critical supplies to face the virus head-on in the coming days and weeks. Last week, we talked about the need for additional staff augmentation to ensure our healthcare facilities have enough people to care for Georgians who need them. And we were proud to announce that, working along with Speaker Ralston, Lieutenant Governor Duncan, the House and Senate Appropriation Chairman and members, that we will continue the state's commitment to hospitals and nursing homes with staff augmentation, with the initial projections putting us at nearly $70 million additional dollars that will be spent through March 6, 2021. Following the passage of the new stimulus bill, we have more good news on that front. Thanks to the bill's passage and signing by Congress and President Trump and increased flexibility as a result, we're going to be able to add an additional $8 million in staffing support where it is needed most in our hospitals, including here at Emory. We are also taking steps once again to address another need that our hospitals have been telling us about in recent days, and that is capacity. In concert with rising cases and hospitalizations due to COVID as well as other procedures, our hospitals have seen an increased need for bed space to treat other patients. And just as we have before, the state is activating a rapid plan to increase capacity and ensure our hospitals are not overrun. I have authorized the reopening of the Georgia World Congress Center Alternative Care Facility with 60 new beds to assist with patient overflow. We each continue to work with our hospital leadership each day to see what new capacity we can bring online, and we expect that the World Congress Center will be able to accept patients by next week, with operations continuing through the month of January. This is being done again through our partnership with Grady Health System. I want to again thank the folks at the Georgia Coordinating Center for helping us act quickly and alleviate strains on hospitals throughout the state. As we look to Christmas and the rest of the holiday season, I know that many Georgians are anxious to spend time with their loved ones, and believe you me, I am as well. But we are also pleading with Georgians once again to do the right thing and stay vigilant. Do not let your guard down, and choose to be part of the solution, not part of the problem. The threat of the virus is still very real despite the vaccine. The general public will not be able to be vaccinated, as we've said for weeks now, for a couple of months. But in the meantime, Georgians, please help us continue to hunker down to stop the spread. Continue to follow the 4 things that we've been talking about for a very long time. Wear your mask, wash your hands, practice social distancing, and follow the guidance from public health officials. And where possible, please limit your holiday gatherings to just a few people in the same household, or consider gathering virtually. If you have outdoor heaters or other means to bear the weather, which is probably not going to be good on Christmas Day from what I'm seeing, gathering outside or trying to spend time outside is definitely helpful. I'd also like to encourage everyone to continue to take the steps to socially distance yourself from those you don't normally see. I know this is hard, but I know that our brave healthcare heroes, including those right here at Emory, need all of us to do our part to keep the virus at bay while we roll out the vaccine. This long battle, as long as it's been, we know it is coming to an end with this vaccine that we have before us. But that being said, we cannot let up. We have to continue to focus on celebrating safely to get us through the holidays as normal and as quickly as possible, so that we can continue the methodical reopening of our economy and weathering this COVID storm until we get everyone in this state vaccinated. So thank you all for being here with us today, and now Dr. Toomey will provide you with the update.